Hello, everyone, and thank you for joining us today for the Moving Minds Alliance Member Showcase, a forum where we spotlight innovations and lessons from early childhood development programs implemented by member organizations, especially in humanitarian settings. I am Lola Ayanda, the Communications Manager for the Alliance, and today the spotlight is on Plan International. In a moment, I'm passing the baton to Camilla Woeldike, the Policy and Advocacy Advisor for Plan International, Denmark. After our presentation, Plan colleagues Sophia and Lisa will take your questions or reflections. Camilla, over to you.
Thank you very much, Lola. It's a pleasure to be here today. My name is Camilla Woeldike, and as you kindly said, I'm the Policy Advisor with Plan International Denmark, and my two colleagues is here today too. Sophia Rocker, who is ECD Program Manager, and Lisa Evertsen, who is Senior Education Specialist. We all sit in the Plan Denmark office, but today we aim to share with you a broader overview of Plan International's ECD and ECD in emergencies work. So we'll be focusing on providing you with an insight into how we work and also to share some examples of how this looks like. Sophia and Lisa support the technical side of our ECD and ECC programming, and I support the influencing part of such programs. So yes, without further ado, I will continue here. So before we dive into the ECD agenda, please allow me to share a brief overview of Plan International's work. We are active in 83 countries, and for those of you who are most familiar to the ECD work, it may be interesting to also be aware that we work across several thematic areas. Among those are inclusive quality education, protection from violence, youth empowerment, sexual and reproductive health rights, skills and work. And then obviously, as we're going to talk a little bit more about today, early childhood development and emergencies. So just a little bit of an overview to set the stage of what Plan International is. We work to provide immediate life-saving support in ECD for children from conception to 8 years in emergency context, but also in longer-term programming in protracted crisis setting and low-resource context. So as we are present in 83 countries, we reached around 43 million children, including 23 million girls. And out of this, early childhood development reached almost 30 million children and adults in this recent year. And as some of you may know, we aim to be gender transformative wherever possible. This means that we are committed to ensuring that all our work is gender aware at a minimum, but even in the most acute settings. But we also strive to ensure a gender transformative approach in our work in protracted crisis and in projects over 12 months of duration. But we can't do this alone. So we work in partnerships with many different partners, both civil society organizations, other NGOs, local organizations, youth organizations, but also the private sector. And in total, we have a little bit more than 36,000 partnerships. And so a little bit about the way that we approached ECD and ECD in emergency. Oh, there's one that want to join. In our ECD programming and influencing part, we prioritize the youngest, most marginalized children, and with a focus on girls and adolescent mothers. We also apply an integrated approach with an emphasis on caregiver support and play. And I think, as many of you know, that research indicates that multiple supports yield better survival and development outcomes than sectoral siloed services. I mean, this is also something we talk a lot about in the Moving Minds Alliance, and I know that a lot of partners are also very focused on delivering in this way. But in particularly, we have an emphasis on supporting parents, caregivers, and households to provide nurturing care to the young children. But we also focus on providing opportunities for young children to learn and play recognizing that not only the importance as rights in themselves, but their potential to promote resilience, psychosocial well-being, and a much needed sense of normality. And we have sort of four focus areas that we try to work through, which is the parenting and caregiving, as I mentioned, the early learning, but also WASH and maternal, newborn, child health, and nutrition. So this is kind of some of the components that we structure our work around. And across all this, we also work with an influencing approach to support the structures and the systems and the governments that we work with to have a more integrated component of ECD and ECD in emergencies. And this both includes community engagement and community awareness, but it also mentioned, as I said before, working in more sort of national influencing strategies. So I'm going to share a little bit about the different programs and models that we have, just to give you a sense of what is it that we do and what are sort of one of the most sort of, or the most common programs that we have. We have a lot of programs, so it's obviously not exhaustive, but it will give you a sense of sort of where we work and how we work. And through many years of working in the ECD sector, working in many countries, we have developed quality interventions that can be easily integrated into our program and influencing work. And we call these the global program models. And they obviously have some quality criteria around them, that they need to have evidence, they need to have been tested in several countries. So they have some sort of parameters to ensure that we can actually safely recommend those and apply them in combination with other program interventions. So these are more the tested and tried global programs, but we also have new and innovative, promising projects going on. So what I'm going to share with you is a mixture of this. But the first one, Parenting Under Pressure, which is been implemented in Myanmar, Burkina Faso, Rwanda, Uganda, and Mali, is a package for parents, caregivers of children aged 0 to 8 in humanitarian situations. But it's also a peer-to-peer parenting programs that aim to empower parents and caregivers to provide nurturing care that supports their children's healthy and holistic development and well-being. And again, this program has a strong focus on the parents and well-being and promoting co-parenting, but also men's engagement. So it has a focus on strengthening support and solidarity networks between crisis-affected parents. And as I said, there is also evidence behind this. There's been several research done that sort of supports the findings and the success stories of it. Then we have Play Matters at Home, which came about in the COVID time. Play Matters was early. It was kind of a restructuring of the program to be able to deliver the program, but it was very successful. And it's actually available online. So it's one of the few resources that we have that has actually been shared and is online to be sort of, looked at. But I'm just going to do this as a teaser because the next member showcase is going to be on Play Matters. And so, tune in for the next member showcase, and my colleague Anne Smiley will present on Play Matters. I think one of the areas that we have quite a few programs and also successful and large programs is in the early learning agenda. Plan International Denmark is also the global account manager for the Lego Foundation, which means that we are responsible for within the organization to sort of manage that relationship. And therefore we also, not therefore, but we have a few legal programs under this portfolio. And one of them is I'm Ready, which is the Plan International Global Program Model. So same as the Parents Under Pressure, it's been going on for a while. We have solid research. It's been implemented in quite a few countries already. But basically, it is an accelerated, intensive pre-primary education program that aims to build the school readiness of disadvantaged children, 3 to 6 years old, who doesn't have access to early childhood education or pre-primary education. And it's delivered 8 to 12 weeks prior to primary school entry, and it aims to develop the physical, language, cognitive, and socio-emotional skills of children. And this is applicable both to development and humanitarian contexts, and it can be used as a standalone initiative or as a component of a more holistic initiative. And it's designed to be low cost. I know we all aim for that, but it is. And it builds on resources present in schools and communities. And again, we have sort of research on this. Some of it shows that there is an increased school readiness, on-time enrollment and retention following the program. And there's also been observed an increased pre-primary education access, school readiness, and parents' participation in Tanzania, where it was also implemented. The last one is the Playful Futures, which is one of the innovative programs that we have. It's just winding up in Uganda. It has very sort of good success and interest also from the ministry and the government. But it's basically a package of interventions designed for pre-primary teachers, mentors, parents, and community leaders. And it aims to enhance knowledge, beliefs, and practices that support the implementation of learning through play in early childhood care and education. And it targets children year 3 to 6. And it's been developed using the human-centered design in close collaboration with teachers, mentors, parents, community leaders, and Ministry of Education. It basically means that it's been developed with the users, and they have been the one informing it, which also means is very contextualized, both in the sense of the target groups, but also the context, which is also low resource context. So it's not specifically a program for humanitarian settings, but it is applicable to settings with low resources. And then the last one, again, a teaser. Tune in for the next members showcase, and my colleague will talk much more about the Play Matters program. Super interesting, really, really impressive findings from the impact studies. So yeah. The last one I just want to mention very quickly is the Eat Play Hawks, which is sort of around the interest of interventions integrating early stimulation and parenting support with food security and nutrition interventions. And it's a fairly new project with Ubongo, and it sort of aims to integrate social and behavior change communications into the early childhood development and into hunger crisis response initiatives. So, you know, fairly new, but also very interesting and very promising projects that we have ongoing. And the last sort of comment on all this program talk is that, you know, while we do programs, Plan International also have internal technical guidance to support our program and technical staff to integrate some of these early learning programs into emergencies with technical packages, with guidance and training materials. So it's one of the things that we do internally to also strengthen this integration approach and also to work to strengthen early learning and early childhood development in emergencies. So we have 2 slides left and almost up for time. But I wanted to share a little bit about challenges, opportunities, and some of the solutions for the early childhood development in emergencies that we see from Plan International. And I think these 2 slides is also where my 2 colleagues will be able to sort of maybe elaborate a little bit more or respond to whatever questions you have. This is a mixture from them and other colleagues and not something I came up with. So one of the first one is obstacles that we face and strategies to overcome them. And obviously there is a lack of funding. There is a lack of funding for everything, but in the early childhood development in emergencies, this is a particular area that we see sort of gets cut out of some of the response calls and some of the priorities. And so the multi-sectoral funding is one of the way that we try and address it, to combine funding sources and have this integrated approaches for ECD in emergencies. So we can kind of slide it in while still trying to sort of enhance the focus on it. And the other one links to what I said already, is often ECD in emergency is often overlooked in humanitarian standards and response calls. And obviously, this also has impact on the funding priorities and the way that funding is channeled. So the call for improved sector guidance and coordination, which I know that Moving Minds Alliance is also supporting on, is one of the ways that we try and address that. And then obviously the last one is the schoolification of early childhood and education. So try and address more the play-based and child-centered teaching methodologies in our early learning programs to get out of this rote learning and very schoolification way of dealing with children. And some of our key insights and best practices, the humanitarian crisis often exacerbate pre-existing inequalities and restrictive gender norms and attitudes, but they can also provide opportunities for transformative change in society. And another one is that engaging fathers in parenting program is difficult because they're often away and they're working. So one of the things that we have also done in the Parents Under Pressure program is to use audio sessions and distribute these through other means, which means that we were able to reach fathers on the move and in their sort of other obligation settings. And then obviously community and peer-to-peer programs in parenting helps increase sustainability and ownership in the community. And this is where I think Plan is in particular having a focus, and a lot of our ECD programs are strong in the sort of the community engagement. And then the last one, that the ECD funding is not very often multi-sectoral. So trying to link up project from our end, not sort of only from the founder and the institution's end, but also from our end, trying to sort of merge some of the programs or direct interventions into the same areas. And I think the last one is where support or collaboration is needing is obviously the joint advocacy on multi-sectoral funding and strengthening sort of this understanding of the needs and the way to address these needs. A little bit of last slide, very quickly, some member offerings and invitations. I think for the projects, the Playful Futures model, as I mentioned, is new. It's coming to an end. It's not developed for a humanitarian context, but it's very much focused on low resource settings. So it's kind of an interesting project that we have going, and we're obviously interested in having conversations around this if anybody is interested. The I'm Ready and Parents Under Pressure, they're not publicly available, but they're tested and tried programs that we continue to assess impact of, and we'd be happy to share learnings and consider integration with other interventions. And then the last one, again, teaser, Play Matters. There's a lot of interesting research and also on the early childhood interventions areas. So stay tuned. The advocacy, I think in general, there is a momentum building in some of the countries that we're working in. And we have a lot of resonance. We resonate a lot with the governments that we work with. Who is also very engaged and focused on improving at least the pre-primary sector, but also the early childhood development focus and interventions. So there is a space for advocacy, and I think that's also where sort of the call to Moving Minds Alliance is to try and sort of get together on some of the projects or initiatives that we've done, among others, the IGOP coming up every year. Yeah. And the last one, the technical, I think as an INGO, we also sit in different boards and working groups. So we have platforms and we have people sitting around that we can also ask and refer to if we have sort of a need for more specific messaging or more detailed information. And then, of course, the last one, which we have also done up until now, we can contribute with expertise on gender transformative approaches, and in particular on the caregiver support in emergencies. So I will round up now. I know I'm a little bit over time, but thank you very much, and back to you, Lola.
Thank you, Camilla and colleagues, for taking the time to share your insights with us today. We will now take reflections and questions. Do we have any reflections on what Camilla has shared, or any question at all? I'm particularly excited about the last slide, like I said earlier, about the member offerings and how we can collaborate. Yeah. So please, if you would like to speak, just use the raise hand button and I can acknowledge you. Or if you'd like to type in the chat or as well, please do so. We have about 7 minutes to call it a day. Trisha, I see you want to speak, but you're muted.
Yeah, I couldn't find the raise the hand button. I'm sorry, I've just given up and put my video on. I'm really I'm interested in a couple of points that you raised. So the whole issue of the sort of schoolification, I think, is really important in relation to sort of what we know about the way in which we need to support children sort of early learning, and this sort of emphasis on things that can be easily measured and quantified in terms of, you know, academic skills. And I'm wondering, you know, given the extensive experience that Plan has had implementing these diverse types of programs, what advice you might be able to give in relation to how we can advocate for a more holistic approach to supporting children's early learning, which isn't sort of narrowly reduced to academic competencies. And then the second question I have relates to the issue of gender, you know, being gender transformative. And I saw, you know, the point you made about, you know, crisis also offers opportunities for thinking differently about how things can be done. I'm curious to know how receptive, you know, parents and communities can be to incorporating new approaches at times of presumably extreme stress that might challenge established ways of doing, you know, established gender norms and ways of collaborating as parents and communities. So they're my two questions.
You're muted, Camilla. Should we take all the questions, or would you prefer to answer each question?
I can go ahead and answer the first two questions, or do my best. I think on the sort of advocate for a more holistic approach, actually in many of the countries we operate, if you do look into governments' policies on ECD, they are written holistically. They talk about holistic development. They do mention a lot of things. So I think in the project, at least, we've been engaged recently, it's not the policy or advocacy level at the high end that is the challenge. It's actually the implementation of it, and the sort of trickle down from a nice policy document that has been approved, or but sort of the actual practice, or at like district level or regional level, to understand how do we then implement this. So I think what we've been trying to do is show a lot of things and sort of use more sort of play-based and these kind of approaches also for the sort of adults themselves, trying to sort of get the message across. But also that it takes time, like it's changing a perception of what is learning, and not only just come. So there's a lot of things into it, and I think we need to be sort of sure it's not a quick fix. On the second one, I'll start, and then maybe Sophia, if you have anything to add. So I think the emergency setting, I think what we've seen is, I'm not sure if we have sort of particularly compared an emergency setting versus a non-emergency setting on sort of gender transformative approaches. But I think it's more sort of a general reflection that it's an opportunity, or sometimes a place where people are open to getting support and getting help, and that also gives an opportunity to raise some of these questions and start some of these dialogues with caregivers. So in, for example, the PUB program, we are talking about like how do you as two parents support each other and share responsibilities. Yeah, I don't know if I think I hope that answers the questions.
Yeah, thank you. Thank you very much.
Bella, I see you have your hands up as well. Do you want to ask your question?
Yes, thank you so much, Laura, and thank you so much, Camilla and team, for the presentation. Sorry, I joined in the middle, but I wanted to pick something. Yesterday, we had our Learning Through Play Communities of Practice launched by our permanent secretary. So we had a half-day meeting and really chatting and conversing and talking about learning through play. And then what was coming out here was about uptake of the concept by school owners or school proprietors, especially in the private schools, but also the parents thinking that it's a waste of time. How do I pay my money? And the child goes to learn through play. So, so I wanted to hear from Camilla and her team about your learning in that regard. Thank you.
Camilla, who's going to answer this one?
Yes, can I give it to you?
Can you hear me?
You can take this one.
I have some issues, I think,
Here.
with the. Okay, I'm speaking into Camilla's computer, so it's difficult when we're sitting all in one room. Yes, so obviously, attitude and behavior change takes a lot of time, and that is also where we can see that working through human-centered design, so working with the people we are designing intervention for, really made an impact, because we took a lot of time in the beginning and also throughout the project to sit down with, for example, parents to really understand what are the realities they're facing, and how can we sort of overcome some of the challenges that they see, and where are opportunities. So we felt that investment and that continuous dialogue and working together made in the end a difference in terms of getting especially parents, but also of course also the other stakeholders we work with on board. We're definitely not at the end of the journey yet, and there's much more to be done. But we feel that is sort of the approach that is working, and that we need to continue to take. And it's of course always difficult when sort of project ends, right? Which Play for Futures is doing now, but hopefully, so these established task forces that exist can also continue to take on that journey and continue working with that. I hope that answers your question, Stella.
Stella?
Yeah. Yeah, thank you. And actually, what was so the meeting, not resolving, but the points that were pointing out that you have to continue sensitizing the communities, and then do a lot of advocacy, community mobilization through messages on radios and other media that can easily reach the parents, appreciate. And then, of course, people like maybe the ministry could do a directive, but of course, it can't do much. You cannot influence so much in private schools. So you just have to continue, showing the benefits, and if they are documented, and then maybe people will pick up and see. And of course, now in Uganda, we have the National Play Day, which the ministry, the government adopted as one of the events, and so we shall be having it every year. So through those activities, I think people will appreciate. Thank you so much.
Thank you. All right, do you have any other reflection before we call it a day today? Just to say thank you to Camilla, Lisa, and Sophia for taking the time to be with us here today. The next showcase will be in March, and it will be more external facing. It will be more of external participants coming to learn from what MMA members are doing. So we look forward to seeing you there. I'll hand over now to Tricia Young to close for today. Thank you.
Camilla, Lisa, Sophia, thank you so much. It's been a fascinating discussion today. Really interesting to learn about the important work that Plan does. I've had opportunities to collaborate with Plan in the past, so I know that you've got very sophisticated programming models, and it's really fantastic to have this opportunity to learn more about them. You are an active member of the Alliance, for which we're very grateful, and we look forward to continue building our collaboration. And I hope that the other members of the Alliance who've been able to participate in this discussion today and to learn more have found it insightful, and we might be, have opportunities to foster collaboration across the members of the Alliance through some of the member offerings that you provided. So thank you very much for being so thoughtful about that. And I wish you all a good morning, good afternoon, good evening, wherever you might be. Thank you for joining us.
All right then.
Thank you very much. Goodbye.
Thank you.
Bye-bye. Bye-bye.